Hey, this is Gerd Handel, and welcome to the Inner Light Project. This show is for anyone who's wanting to lead a happier, healthier, and enlightened life. Create more self-love, inject more joy and abundance into their daily life. Join me for inspiring interviews and spiritual topics so you can shine your inner light. Hello and welcome to another episode of the Inner Light Project. My name is Gerd Handel and today I want to share with you just such a beautiful soul, and she's helping so many women in just such a beautiful way, which it's so important in this day and age because so many women are struggling with this situation more than ever before. She's helping women to overcome infertility. Now, Dr. Katie Rose is a licensed naturopath, physician and fertility coach, and she's helped hundreds through her unique 3-step method to support the mind, body and spirit despite years of unexplained fertility. She believes we can all conceive with the right tools. Hi Katie, I'm so grateful to have you on the show and thank you for joining us.
Oh, I'm so excited to be here. Thank you.
You're welcome. I just love how we met and this amazing group of women, we've just come together, and I just want to share your journey of what your life was like before you ended up in the fertility world, because I know there's so many people that would be intrigued by this.
Well, you say journey. It has been one, and I do very much believe that through all of like the hard parts that brought me here, like I was being guided, and I never saw myself it as a naturopathic doctor, as a fertility doctor. Like I knew probably by the age of 12 that I wanted to be a doctor. So that part I felt very sure about. But I very much waffled between like psychiatry, but then I would be fed these stories like, oh, well, if you're a psychiatrist, then you're just going to talk to crazy people all day long and have to give them meds. And like, that's going to make you crazy. And then I was like, okay. And then I struggled in high school with horrible cystic acne. And I was like, well, maybe I'll be a dermatologist. Like, not only do they help people, improve their skin health and by way their self-esteem, they also have a really good schedule compared to some other like hospitalists. Like, dermatologist gets a 9 to 5 versus, some of these specialists that I knew who, just had these crazy hours working in the hospital. And so I, went to shadow my dermatologist, and she was, a realist, and was just like, well, it's a very hard path to get into dermatology. It's the most competitive of all the subspecialties. And I was like, okay, cool. What does that mean? And she's like, well, you're going to need to have like published papers by the time you like graduate from college. And like, if you want to start that, you need to start it like now. And I was like, well, that's what I'm doing by asking you these questions at 15 years old. Like, okay, lady, like
chill out, lady.
Yes. And so, but I continued on that path. So like when I was in college, I stalked my friend's uncle who was a dermatologist, and he let me come into his office once a week, and I would do grand rounds with him. And then the chief of dermatology from our college noticed like, hey, you have this like 20-year-old girl following you around. What's happening here? Like, why is she so interested in this when she's just like, a second year in undergrad? And he thought that was great. So he was like, well, you come to my office next. And so then I got to do rounds with the chief of the residency. And that was such a fun experience. He actually had me assisting in minor surgeries. He specialized in skin cancer and a special procedure called the Mohs procedure, which like takes layer by layer each cell layer when someone has been diagnosed with a skin cancer, and you want to make sure that you've cleared the entire lesion. Wow. And so I had these opportunities to actually see what that lifestyle was like. And I was fascinated by the medicine part, and also a little discouraged because you would have these people who'd come in with these chronic issues like eczema, psoriasis, acne. And I would ask questions like as soon as the patient would leave the room, I was sort of, put in this role of like be seen and not heard. Like you're an undergrad, so you can't ask them questions, but you can ask us questions once the patient leaves. So I would ask, like, what do you think their diet has anything to do with these symptoms that they're presenting with? Like, what else can we be thinking about? And they were like, no, no, no. That makes no difference. That's all a myth. And it felt so untrue to me. And I was
Mm.
just like frustrated. I felt like I was like in this box that I wasn't allowed out of. And eventually there was actually sort of this tragic situation with the dermatology residency program at our university that they got shut down. And I was like, huh, well, that means I'd have to like leave the state of Arizona to do my residency. And I don't really want to leave Arizona. Like,
Mm.
I don't want to go to Iowa. And so I just started thinking like, well, maybe there's some other path for me. And it was later that year that I started getting sick frequently.
Mm.
It started with a sinus infection. I was given antibiotics. The next month, I ended up with a urinary tract infection. I was given more antibiotics. A couple months later, I ended up with the flu and pneumonia, more antibiotics. And then I kept getting urinary tract infections over and over where we thought it was. But really, it was this condition called interstitial cystitis, which is like a chronic inflammatory condition. It feels like you have a bladder infection all the time. It's incredibly painful.
Oh, wow.
And yet, there's no infection. It's just this inflammatory process that they now believe might be partly autoimmune related. But as with so many health conditions in women, it's very under researched. So
Yeah.
I was led down this couple year long journey of just going to doctors, going to specialists, being told what my options were, but never feeling like those options really resonated. So it was, pain management, like heavy duty medications for pain,
Mm.
bladder installations where they would like thread this catheter into your bladder and infuse it with medications. And
Wow.
I
Wow.
like, I was like, I don't want to do any of that. Like, I hate
Mm.
this and I can't live like this. And like, what are my other options? And I had a doctor say, "Well, I feel like we've reached the end of the road for you. If you don't want to do those, like this is
Wow.
just you can just expect to be in pain." And I left her office in tears. And her nurse practitioner pulled me aside, like literally into a closet, and said, "Listen, you are too young to be going down this chronic health path. You have to go see a naturopathic doctor. All of our patients who see one are healthier for it. And I could probably get in trouble for telling you this. So I'm just going to scribble her name down on a little sticky note. I'm not even putting this in your chart, but like, go do this." And I just thought, well, that was a wild interaction. But bless this woman, like this angel
Mm.
who gave me this information. I had never even heard of a naturopathic doctor before that point.
Wow.
And, we didn't have social media in whatever it was, 2006 to
Yeah.
be spreading this information. Um, I I sat on that for a while. I didn't actually end up seeing this doctor whose name she wrote down for about a year because I was anxious about the investment. Like
Yeah.
this was something that my health insurance wouldn't cover, so I'd be paying out of pocket. I was a college student with a minimum wage job and was like, oh, am I really going to drop hundreds of dollars on this? Like, what if it doesn't work? So I really had to hit my version of rock bottom before I went to see this person. But when I eventually did, it was like this aha moment of everything that I have felt to be a true influence, like was true, even though I was brushed off. So, what you're eating, what are your stressors, how are you sleeping, what's happening in your environment. And I learned so much just in that first hour long session. I was asked so many deep questions and listened to, and I felt like I was in a partnership with someone instead of just a number.
Mm.
And that was this awakening like, oh, this was the path that I was meant to learn about.
Wow. Wow.
So that's what led me to naturopathic medicine.
I just want to say, I love the journey that you've been on, because a lot of people would have given up and just said, you know what, I'll take whatever you're giving me. But it's like your curiosity in you was like, no, there is something better out there for me. And then the universe was like, hello, let's give you that now. Like, I love that. And I relate a lot with you on your journey as well. Like, it's so funny how we are so focused on one career path, thinking this is the way and we're going to follow it. I did the same thing. I did
Yeah.
so many placements when I was younger. Like, I always thought I was going to be a journalist. Like, from the age of 15, I was like going and meeting people and doing everything I possibly could. But then, as yourself, I kept getting sicker and something just didn't make sense. And it was not till years later where I had the aha moment and I went and did the inner work. But then when I got sick, I had to go a different route as well. But again, I actually work, I don't think a lot of you, actually, I don't think any of you know this, but I used to work in a pharmacy when I was at university. So
I
I am,
didn't know that.
yeah, so I'm, I'm a trained, well, trainee dispenser. So when I was working on the weekends whilst I was studying journalism, it's so random. My boss at the time was like, "Hey, do you want to go into the pharmacy section in this place? It's called Boots in England, and it's a huge like store." I was like, "Okay, does it pay better?" She's like, "Yeah." So I was like, "Okay." So I was a sales assistant on the pharmacy counter. Then I had to take exams, and then I became a trainee dispenser in the background. And as I was dispensing the medication, I used to think, why is this person taking 10 medications? So I was already questioning at the age of 19, like, this does not make sense. But obviously, you take one medication, which leads to another side effect, and before you know it, there's a bag full of medication. So I started questioning things and the holistic world slash the medicine world from a young age. But it's not until we get sick that we actually start to understand the body, the mind, and the spirit and how it works. So, yeah, it's so fascinating to know how you ended up in what you did, and also how I ended up healing as well, was not down the original routes and how society has taught us. It's more the maternal and the matriarchy and the holistic approach.
Yeah, and that element of matriarchy I think is so important here because I had to learn how to deeply tune into my body and
Mm.
my intuition, which is not something that the patriarchy is cheering for, right? And and we can absolutely get into this around like how I strongly feel it plays into fertility as well, but just like, as a woman raised in this Western culture where there's expectations and there's hustle and there's 9 to 5, and it has nothing to do with our internal cycles or our intuition or that inner knowing. Like that's something that I really had to go against the grain. And I remember when I first started talking to my friends about like, hey, I think I might want to go to naturopathic medical school. And, we were all pre-med. And so these are all friends who were like going to be going on to traditional medical school. And it's funny how you can look back and like see who your true friends were. Because the ones who were like, you know what, you're fucking brilliant. And whatever you do, you're going to be great at are the ones that I'm still friends with. Right. And the
Mm.
ones who were like, are you crazy? Like, you're going to go down this hippie, like, what? Why? That's so weird. Like, why would you do that? And so I really had to sit with, like, if I go the traditional medicine route, like, yes, I could eventually, like, I could do a residency in integrative medicine. Like, functional medicine really wasn't a thing 17 years ago. So I couldn't quite see a path of, like, how to get to where I wanted and, like, the knowledge that I wanted around herbs and Chinese medicine and acupuncture and homeopathy and energy medicine and just understanding like the body as a whole and not just looking at like here is one system. You're going to look at skin and you're going to look at digestion and like I I couldn't grasp like how you would get there from going the traditional route. Whereas when I looked at the naturopathic curriculum, it just like yes, it had some elements that I was like, this is out there from what I'm used to. And I don't have to take all of it with me into practice. Like there's more flexibility in how I can take this into the world and help people. And if I can just help one person not go through what I went through, it will have been worth it. That's really what I led with. I had to lead with my intuition. I had to lead with my heart and my gut and my sacral instinct on this.
Mm.
So I was like, if I go the traditional route, I'm going to be like that one fish always swimming against the school. And that's going to be its own set of challenges. Whereas if I go the naturopathic route, like my curiosity will be embraced, is how I felt. And that ended up being true. I don't think there's any perfect program or any perfect curriculum, but that's what I needed.
I love that. And I really understand where you're coming from because when I worked in the pharmacy, I could see how everybody was like, they followed the books, they followed the protocols. And then my friends who were doctors as well, like, it was like, this is the only way. And I used to remember saying, isn't there another way? No, 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 we have to follow this, this, and this. And it's like, because medicine hasn't changed over, I think, 50 years, like, the books are still the same, nothing has evolved. Women's knowledge about their bodies, it has not shifted. Everything is based on the male's body, which is why women, I feel like, are suffering in terms of their health and their well-being, and in particular fertility. And I kind of want to bring up this topic because we were talking about it before we got on this call, like how the patriarchy is keeping us disconnected from our bodies, but the matriarchy is bringing back home to ourselves and our natural flow of fertility. What would you say?
Mm, okay. I'm just gonna put it out there that I feel like patriarchy is the root of all chronic illness, including infertility. And I say this not just from like the energetic piece that patriarchy really asks us to shut down our intuition and go against the flow of our cycles and that way of living, but also because it is patriarchy and capitalism that has contributed to like this chronic inflammation of the planet. We have so much pollution. We have this corporate greed that puts the dollar as primary goal over the health of our planet. And that is having its consequences. And so when people ask, well, why are we seeing increased rates of fertility?
Mm.
We could say, well, there's a combination of like some, women are waiting longer to start a family. They're focusing on career for a little while first. And there's also this element of like, well, we have more environmental toxin exposure than we've ever had.
Yeah.
And that has its effects on disrupting the hormones and disrupting sperm quality. And
Mm.
so there's multiple factors for why I believe that patriarchy is the root of so much chronic illness. Um, but yeah, it has to be said. Like
I-
we have to name it before we can do something about it.
yeah. And I think it's only now we're starting to realize the similar link of like what's happening to women in their bodies. And I think we have seen, and I know our generation, we grew up with mothers where like the shoulder pads era, very like being your masculine energy. And so from that time, by the time we were born, like we were very like, let's get in our masculine, let's get shit done. And of course we didn't know how to be in our feminine, which is obviously part of the fertility and the nurturing of the womb. And that's when I started to see a rise in a lot of people having like infertility issues. Like I do remember seeing that with a lot of people like that I know. And I think part of it is that being in that masculine slash the patriarchy and not us knowing how to be in our feminine flow, which makes it easier in many ways.
Yes, the how to slow down. I have this conversation almost daily with my patients and clients is like, when I ask you to slow down, like what comes up for you? And people were like, ugh, slow down. What do you mean? Like you mean like sit and do nothing? Like, like sometimes maybe. But ultimately it's like when you are following the hustle, when you are always in the noise, when you are serving someone else's agenda, you're not going to have access to your intuition. And so, like, the root of the work that I do is helping your body feel safe to conceive. But I also warn people that ultimately, like, I am working for the souls who are meant to come in more than I'm even working for the person who's sitting in front of me because, part of the matriarchy is that we center the mother and the child. And that goes beyond just living into feminine flow. That means we are building a planet that is healthy. We have clean water, we have clean air, we have a family focus, and whatever, that doesn't have to mean this nuclear family, but it means that we are supporting women and children, and we are putting them first in such a way that allows them to thrive as their authentic selves.
I love that. And that is what is key. So that's what we're missing in the world, isn't it? And I definitely relate with you talking about slowing down because had I not had my health condition, which you know about, I was born with a kidney defect. I didn't know till I was 30, casually. But also after having the operation, I got kidney disease. Like, had I not had that and had the hardest time those 10 years, I wouldn't have slowed down. I don't think I would be here right now because I was obsessed with success and being successful, the masculine energy. And I had no choice in those moments. I had to rest when I didn't want to rest. I fought with myself for years, but actually that was the medicine. And actually, I'm so grateful for that because I now know how to be still and be present. And a lot of us don't realize that until something happens. And it's almost like we have to unlearn those patterns, like you're saying, and just really learn to slow down, starting at the early stages.
Yes, the early stages. Like I love when people come to me a few years before they even think they want to start a family. Like it's like as soon as that little seed has been planted in their mind that I think I want this. What do I need to be aware of to make sure that this is the healthiest pregnancy, the healthiest baby? And some of that there's still an element of like control and wanting to achieve and be successful. So I always just get very curious around like where is that drive coming from and how wonderful to be thinking about it so far ahead of time so that we can support you before you get to a point of, the definition of infertility being if a couple has been trying for a year and has not successfully conceived. So, a lot of the people that I get who have been trying for over a year, some people 10 years, it's like they are so much more in that seat of anxiety and desperation and frustration. And there's so much more emotionally that we have to process. And it's all part of the journey. I trust that I meet people at the exact right time I am meant to meet them. But I also just love so much when we have this opportunity to build those foundations at the very, very start of the thought, like like the literal conception of conception moment. Uh, that is so remarkable to see how those parents' journeys ultimately play out is they've learned all these tools of regulating their nervous system and connecting with their intuition. And it's as if, they are already consciously parenting well before this baby comes earthside.
I love that. I guess that's being in the present moment, isn't it? The flow, the slowing down, like you're saying, it's not being rushed. And I think, yeah, that makes sense because a lot of people are like rushing to get pregnant. And then that stress builds on the body and the body can't relax and then flow. Yeah, that just makes so much sense. It's so interesting, isn't it? A lot of us don't realize like how much wisdom there is within our bodies when you do want to conceive. Like it's a lot of it is to do with being present in the body versus, like you said, wanting the control, wanting to get to the end route. It's about being in that moment in order to move forward.
Yeah, and being in your body when so many of us have been conditioned to be logical and think about it rationally, and then we end up in this place where yes, we are overthinking, we are analyzing everything, we are so reliant on the data and the labs and the control and wanting to understand. And when it comes down to it, fertility is anything but logical. Like if you've ever taken an embryology class and you think about an egg and a sperm coming together and the fact that that can grow inside another being's uterus and create a fully formed human, it's like, it's mind blowing. It truly is. Like I sit there and I'm like, it is so miraculous. It is not logical at all that we carry this blueprint. It is all a fucking miracle. How can we lean into that?
Never thought about it. Now my brain's going, oh, like, yeah, that makes so much sense. Wow. Wow. The body is so powerful, isn't it? It just
It's
honestly.
wild. It is so wild. And you know, because you've gone on your own healing experience, how
Yeah.
remarkable it is, how much wisdom is within it when you slow down, when you can get intentional, when you can ask questions and actually like believe what your body is telling you, even if it makes no logical sense.
Yeah. Well, again, I think that's
Uh,
the patriarch. Sorry, I was just going to say, I think that's the patriarchy, isn't it? Because we were, as young girls, we were taught to listen to everybody else, right? Listen to this person, listen to that person, but never listen to yourself. And that's generational. That goes back from our mums, great grandmas, and so forth. So, of course, women struggle to trust in themselves and their intuition because we've never been taught how to. And so it's almost like peeling off all these layers in order to
yes,
trust
it so is.
ourselves. Yeah, yeah. Because I don't know about you, but for me growing up, I did not trust myself. I'd be like, what do you think? What do you think? Like, I never actually sat with myself, hey, what do I think? But my intuition knew, and I'd be like, no, 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 I'm not right. And when I would ignore it, I'd be like, oh my God, why didn't I listen to myself?
I, so it's interesting. So a few years ago, realized that I realized this earlier, but I didn't know what to do about it. That, you've got those people who do everything right, right? They follow the protocol perfectly. You can give them a checklist and they will check everything off every single day. Like you've got the perfect patient, right?
Hmm.
The most compliant patient. And yet they're not getting the results. Their
Hmm.
labs look perfect. They're doing everything well. Why are they not getting pregnant yet? Everything, those are the true like unexplained infertility, but like not
Yeah.
really unexplained when you're willing to look at the other layers. So
Hmm.
the layers of conditioning, the mental, the emotional, the spiritual pieces. So I realized many years ago, like, oh crap, I've got to learn more. There's more to be, there's more to be had here. And I realized that I was sort of intuitively doing some things with that. Like I was sort of intuitively using these hypnotic tools to help people move through fear, to help people recognize limiting beliefs. But I was like, I feel like I need professional training in this if I'm going to be like accidentally doing these techniques with people. So on that's a very interesting thing to bring up. Like, we're sort of conditioned. So it's like I was already intuitively incorporating things into my practice to help people move through the conditioning. But even I felt like, oh, I need a professional certification in this. And I'm still glad I did it because it was fun. I met other people. I can now say, like, oh, I am a certified hypnotherapist and neurolinguistic programming expert. So I now have more tools to help people work through that conditioning.
Yeah.
There's so many things that we come up with, when we're that 0 to 7, when our brains are just sponges, we're taking in everything from everyone else and we're taking it on as belief. We're taking it on as like, this is fact. This is what I'm rolling with now. This is just my story and I'm sticking to it. But when we remember that our brains are neuroplastic
Hmm.
and that a limiting belief truly is just, a story that we are carrying that is holding us back from a different reality that we could create. And the types of stories that some people carry, like I don't deserve to be a mother, or I can't trust my body to do this,
Hmm.
or my career is not compatible with being a mother. There
Wow.
are so many things that arise that many of which can come from core wounding that
Wow.
we learned as children or that we witnessed, when someone else close to us was going through a journey. So I think just being able to tune back into your intuition, decide what you want, and use tools to work through that. Like there's just limitless possibility.
Wow. This is amazing. And I think it's going to help so many people to have the awareness, like who are struggling right now with fertility. Why is this happening? Well, actually, we need to look at the conditioning and the layers, and they should definitely reach out to you. So, where can my listeners find you?
Oh, thank you. I am on Instagram at Dr. Katie Rose, and you can also find me through my website, drkatierose.com. And I have a podcast called the Brilliant Fertility Podcast, where I go into a lot of the nuance of, these layers of the physical, mental, emotional, and spiritual as well.
Oh, I love that. We will have that in the show notes. Um, and oh, there are a few more questions I want to ask you actually.
I'm
Um,
here for it.
what are your 5 top tips for someone who's struggling to conceive and they don't really know where to start?
Yeah. My first tip would be to not do this alone. This is not a DIY project of like reorganizing your closet. This is like deep life and death work, right? So, working with someone who has an understanding of how the reproductive processes work, but also that your body is extremely wise and there's something to learn from how your body is showing up to this moment. So, that would be my number one is don't do this alone if you're already struggling. My number two would be really learn about your cycle. This is another piece of, the patriarchal system is like we are so disconnected from our menstrual cycle as part of being disconnected from our body. It's been stigmatized, it's been hushed, it's been something that's like, ooh, like, oh no, we don't talk about periods. And it's like, oh, but it's life-giving. And if we don't understand the vital signs that our cycles are telling us, we are missing a huge piece of information. So I love teaching women how to identify the different phases of their cycle, their fertile window, like when they're ovulating. A lot of women get very hung up on like using ovulation prediction tests and using their apps to tell them when things are happening. And it's like if we can just, cut out all the noise for a moment and be with our body and learn from it, that's where most of this wisdom is going to come from.
Wow, love that.
My third piece would be to slow down.
I love that.
Slow down just 2 to 5 minutes a day of like being in a quiet spot where you can first, this is kind of how I do it. I'll script it. So how I had to approach like my, chronic health pattern, my interstitial cystitis is I would just sit quietly and I would first just run through what I was grateful for about my body. Like, what was it doing well? Because you could put so much focus on what you are currently struggling with that is where the attention always goes, right? Yeah. So this would kind of just expand perception of going like, okay, I'm so grateful that my heart just keeps beating without me ever having to send the instructions. And I'm so grateful that I can just breathe easily. And I'm so grateful that when I open my eyes, I can see everything around me. And then I would sort of scan and notice, like, okay, what's speaking up? So, like, if my bladder was having a really loud day, I'd be like, okay, body, like, I can tell that you are really activated today and that this symptom is speaking up really strongly. And if there's anything I need to know, I am ready for this information now. And I'm sorry that I've moved so fast that I wasn't listening for so long, but I am here and I'm ready and I'm willing and I'm open to hear your wisdom. And the first many times I did that, like nothing came through, but it still just like felt good to just say the things. And I said it out loud. Like I would literally just say this out loud with my hand like over my low belly, like bladder area. And I've had people do this with, fertility struggles, whether they've had ovarian cysts or endometriosis or just the quote unquote unexplained infertility. And it is just so amazing what eventually pops into their awareness. And this is not something that we could discover on a lab test, right? Like we can't gather that wisdom from drawing blood. We have to actually slow down and listen and learn this for ourselves. My number 4 would be to really learn how to nourish your body in the way that it needs. And like we are all physiologically so individual in what nutrition our body will thrive on. And so you can't just take, this protocol that Sally is doing and say that's going to work for me. You actually have to learn like what does that look like for you in terms of nourishment, and your cycle will aid you in that as well. And my number five, gosh, I don't know that I have something like readily lined up because I especially like don't want to overwhelm people, but uh, I I try to be very intentional with the amount of like environmental exposures that I have. And so, especially in this world where like we're surrounded by plastic everywhere, and I don't want people freaking out and like panicking, but also like if you can just move away from your plastic water bottle and use glass or stainless steel, if you can start storing your food in glass containers, not reheating your food in plastic containers,
Yeah.
not using synthetic fragrances, like this can make such a big difference in your like personal toxic burden and how well your hormones function. And for men, how much their sperm respond to this is just incredible.
Wow.
So that environmental piece, I have a couple of podcast episodes on if that's like a rabbit hole that people want to go on that feels supportive. I do try to have those conversations from an empowering rather than like a fear mongering place.
No, no, I hear you.
But
Yeah.
yeah, but that would be my number five.
I love that. And it's so interesting you're saying that because years ago when I was really sick, that's what I started to do, change things like everything is glass. And one thing I actually took out was, you guys say aluminum, we say aluminium. But that was a game changer. I used baking paper instead. And I have noticed like I have low heavy metals in my body now than ever before. And but we don't question it. That's the thing. It's not to scare people. It's just that we generally don't question things as to why we're not feeling good and what are we using that is not making us feel good.
Yeah, yeah. And it's also remarkable to me how you can tell someone this information 1,000 times and they may not absorb it and hear it. And so if we were to tack on like a number six here, there's, fertility is usually a partnership. I do work with same-sex couples. I do work with mothers who are choosing to single parent by choice. However, most of the time it's a partnership. And so we have a male and a female partner, and they're, maybe on different pages. And if there's one partner who's like going all off the rails on making all of these environmental changes and changing the diet, and the approach feels very aggressive to the other partner and they start to withdraw or rebel, it's like this is where having help from someone who is trained, who can guide this path in an empowering way, can release so much tension in relationship too. So like you have to take the whole relationship, the whole couple into account with this. And the sperm is providing 50% of the DNA. So we really do need to get these guys on board with these changes. It's actually vital.
Wow.
And we have to learn how to do this in a way that doesn't just pile on shame and blame and continue to use these patriarchal tactics to get people to comply. And that's an art.
That is so true. And actually, I can hear what you're saying, but sometimes it's one or the other that is the one that needs more support in, but together as a union. Yeah. Wow. I love these five or six top tips. They're amazing because honestly, I've never heard anything like this regarding fertility before. So
Oh, wow.
you are going to blow everyone's mind.
Thank you. Thank you for getting this out into the world in a greater fashion, then. I appreciate that so much.
You're welcome. What are you most grateful for? That's one of my last questions.
Oh, gosh. What am I most grateful for? I think just maybe like just being alive,
Hmm.
getting to have this lived experience, being with the children that I have. I have two boys who are just like so brilliant and hilarious, and getting to meet the people that I've gotten to meet, especially like you and our sister circle that I call my coven.
Oh.
And, even though we are living in this like truly batshit crazy time, that I sometimes wonder like, why? Why? This is, how is this even possible? I I really I'm so grateful to like be a part of it and hopefully be a part of the next generations having an opportunity to live in a better place.
I love that. Thank you so much, Kate, for being on the show and sharing your wisdom with us and answering to the call of fertility, because you are changing so many people's lives that wouldn't have happened if you didn't go on that journey. So thank you for being you.
Thank you, Guards.
You're so welcome.
Thank you for being you too.
Oh, bless you. What a great interview. I adore Katie so much. When we met at this retreat in January, it was just sisterhood at first sight. We just got each other from the moment I met her, and she has such a pure soul and genuine energy. And when we started talking about fertility, I definitely realized that a lot of us are unaware why so many women are struggling to conceive more than ever before. And it got me thinking, when I'm ready to have children in the future, I will definitely need guidance about it, because it might be certain foods or certain tools or certain energetic things that I haven't thought about. Because again, the system hasn't taught us about these things. It's only now we're kind of learning the alternative way. And yeah, I just love Katie so much. Now, if you're struggling with fertility issues, do check out Katie's website and send her a message. And all her information is in the show notes below. Unfortunately, that's the end of the show. Before I leave, I want to leave you with this quote. "Nothing is impossible. The word itself says, I'm possible." That's a quote by Audrey Hepburn. Now, if you're struggling to liberate your mind, body, and spirit from patriarchal people pleasing, and you want to trust the wisdom from within and speak your truth, visit my website at www.gerdshandel.com and my program, The Liberation Alchemy, where I teach you for 4 months how to let go of all the patriarchal, cultural, society, familial trauma, so you can really come back home to yourself. And remember, stay happy, stay healthy, stay lit.
Lit.